So on September 20th, 2017, the life of every Puerto Rican in Puerto Rico and in the United States changed forever. Hurricane Maria struck the island as a hurricane, a Category 5 hurricane, and that was really difficult. People have to understand that Hurricane Maria has been the largest natural disaster in the history of the United States. It's the strongest and largest natural disaster in the history of Puerto Rico since 1899. On top of that, we have an unfolding mental health crisis. Immediately after the hurricane, what we're seeing is an increase in depression, anxiety, PTSD, suicides, and suicidal ideations. So basically, crisis hotlines, mental health professionals who provide services there, they are doing whatever it takes to keep people healthy, but it's very difficult. So currently I'm conducting a research where I'm doing interviews to individuals who provide mental health services in Puerto Rico following Hurricane Maria and Irma. And what I really want to explore with them, number one, is what they consider to be the psychological needs of the people of Puerto Rico following the hurricane. Number two, what are some of the challenges associated with providing those services? Number three, what they consider to be the best practices, what it is that we're able to provide and what seems to be helping them to get better.
From a humanitarian standpoint, we have to count each day as a blessing. We don't know what's going to happen tomorrow. And the fact that our brothers and sisters in Puerto Rico are suffering like they are, we could only hope that if we were ever in their shoes, that we would receive the same outpouring of community support and love. So I think that's why it's so important to show them we're here for them.
Eye on Research is a production of New Mexico State University.